to 0. Next, we have a presentation on our response to this COVID-19 crisis. We'd like to call up Marni Kuyl, our Director of Health and Human Services.
Okay.
And for everyone on Zoom, we do have a presentation today, so hopefully you can all see that just fine.
Good morning, Chair Harrington and board and Zoom friends out there. So as Chair Harrington said, I'm Marni Kuyl. I'm the Director of Health and Human Services. And today I want to give a very high-level overview of our reopening planning that's happening in Washington County. So if we can go to the next slide, please. So, I'll start, of course, with, as usual, the numbers, and those are as of May 4th at 8 a.m. These are cumulative numbers, so they are since February 28th. Washington County has had a total of 528 cases, 115 hospitalizations. We are testing an average of 264 people a day in the last week throughout Washington County. So cumulatively, there's been just over 93, almost 9,400 tests completed in Washington County. And you can see also the numbers for the state of Oregon. So next slide, please. So Oregon framework. We are learning more, sometimes hourly, from the governor's office about the Oregon framework for reopening. We're following the guidance and getting more information every day. So as a reminder, it's really important to understand that Governor Brown is the one that has the authority to lift her executive orders. So this plan is so that we're prepared as a county for reopening once the governor lifts those orders. So the governor has provided some prerequisites that will need to be met before jurisdictions are able to reopen our businesses and other activities. So the first is declining prevalence of COVID-19. This is defined as decreases in emergency room visits that are related to COVID-19-like symptoms and reduced hospital admissions. The second is robust case investigation, contact tracing, and capacity of local jurisdictions to provide isolation and quarantine. And what's described is that we'll need at least 15 FTE per 100,000 within a jurisdiction. By our estimates, and also taking into account some national evaluation of the need for contact tracing, for Washington County, that's somewhere between 90 and 100 FTE. And we're working on that plan now. You'll hear a little bit more about that. The third area is increased COVID-19 testing, and the metric for that is that we have the capacity to provide 30 tests per 10,000 people. And then the last prerequisite or gating criteria is adequate hospital capacity for surge, and that's been defined as the ability to handle a 20% increase in patients due to COVID-19. And that also includes PPE, and the standard for personal protective equipment for the region is that we have a 30-day supply.
I have a question about the testing. Should I ask now or at the end? So you talked about the testing of 30 per 100 for 10,000.
Right.
So who controls that? Because I understand that the guidelines have been modified by OHA about who is recommended for testing and the guidelines for administering a test.
Right.
But does Washington County through the EOC control either the guidelines of who can get tested, and then does it control the distribution of tests?
Right. So yes and no. No, we don't control the amount of the capacity of testing, because there's a lot of different layers of testing. So there is Oregon State Public Health Lab testing that's available. There is also private labs, hospitals, clinics, and some national testing organizations that are coming into our community. They don't necessarily have to let us know if they're doing testing and who they're testing or how much they're charging. But we are trying to collect as much of that information as possible, and we now have a new testing area on our Washington County COVID-19 website. So you can go onto the website and see what information has been shared with us about who's doing testing, when they're doing testing. The other thing that I'll say about the testing is we are also developing as part of this plan, and you'll hear a little bit more about it, is the ability for public health, so that would be Washington County Public Health, to do hotspot testing. So we're working with Metro West Ambulance, Virginia Garcia, Neighborhood Health Center to assure that we have that capacity as well.
Thank you.
Another follow-up question. For opening, you reference as a parameter 15 contact tracers per 100,000. But I remember a couple of weeks ago, you said that really, when we ramp up our own internal forces to do the contact tracing, that a industry standard or public health science standard is 30 per 100,000.
So the standard for testing is 30 per 10,000 capacity to test 30 people per 10,000. The standard for contact tracing, there's been a couple of standards. We've been using a national standard that was set by a national public health organization, which estimated that Washington County would need 90 to 180 FTE. The Oregon guidelines that came out yesterday, their standard was 15 per 100,000.
Which struck me as almost exactly half of what you had suggested we should be, because you had talked about 180 people, given that we have 600,000 people. So my question is, this 15 standard, is that simply just to get us started and opening up, but that we really do need to double that at some point to really make a meaningful
And I
difference
think,
from a science and public health standpoint?
yeah. So right now we have different guidance coming out from our national organization in the state of Oregon. So I think we'll be looking at that really closely. We have been planning based on the 90 to 180. So our plan has been based on that guidance, but I think that we'll be able to get a better understanding from OHA, because they also have some state support that they might be calculating into the need for local governments, if that makes sense.
Okay.
Okay, thank you. Next. Public health, what we are so proud of in Washington County with this board and with our community is that this is a public health informed phased approach. Our governor, you all as our Board of Commissioners, and all of our leaders in Washington County are really using this informed public health approach. So the approach is broken into 3 phases, and each of those phases, moving through those phases really is dependent on the data that we talked about that's part of the prerequisite or gating criteria, because we can't go backwards on that. So as a reminder, if Washington County sees a rebound of cases, hospitalizations, if our public health system or our healthcare system becomes overwhelmed, we may be making recommendations to move backwards towards the more restrictive levels of physical distancing and protective measures. So it's not necessarily a linear one-way direction as we move through these phases. And so the phases really, phase 1 is opening some businesses, and we'll talk a little bit more about what those are, with physical distancing, face cloth coverings, and recommendations for people that are high risk, over 65, or have medical conditions to continue to stay home, to stay safe. And then as we move into phase 2, it's really a lot of the same recommendations, a little bit more leniency with businesses opening, increased in the number of gatherings that are allowed. But there will continue to be physical distancing guidelines and continued recommendations for face coverings. And then phase 3 is what we really know the least about, and there's still a lot of questions about the size of gatherings that will be allowed during phase 3. Does that mean, for example, large venues, concert halls, movie theaters, go back to full capacity, sporting events? So all of that is still being discussed and reviewed. Okay, so now I'm getting into a little bit of some of our assumptions. So what we're recommending for reopening phase decision-making process, we will be bringing back the full reopening plan to the board. We are going to be asking for board input on the plan and eventually board approval of the plan. Once the board has approved the plan, public health will monitor the gating criteria or the prerequisite criteria and make a recommendation about whether we're ready to move to a new phase, or in the beginning, whether we're ready to move to phase 1. That recommendation would go to the county administrator, who would approve the recommendation. And then our EOC and our public information officer and everyone would get hard at work making sure that the public, the businesses, and everybody impacted by moving through the phases is notified. And you'll see in this graphic that it looks as if it's always moving in one direction, but as that reminder that there would be times that public health may recommend that we move backwards to a previous phase. Okay, so some assumptions that we're developing this plan based on. So one is we are really following the governor's guidance, and that the plan would be brought, discussed, and approved by our board, that it's a phased approach with regional coordination, and that physical distancing and face covering will probably be with us for a long time. That we will continue to ask people that are at high risk for COVID, severe illness from COVID, that we will continue to ask them to telecommute, to stay home as much as possible and protect themselves. And the EOC role is really about supporting our community as we move through these phases, and we'll talk specifically about that. The other thing is that as we move into contact tracing, isolation, and quarantine, that we'll be going back to an area where we're asking people who have been exposed to COVID, if they're sick, to isolate, and if they're a contact, that they will need to quarantine. Okay. I printed face back to front, so saving paper. So community reopening principles. So our principles really probably aren't going to be very surprising, but really this is about saving lives and mitigating the impacts of COVID-19. It is shared leadership with our community-based organizations and our cities. We will continue to put equity up front and make sure that as we're making decisions and changing priorities, that we ask, what are the potential unintended consequences and what are the consequences to different populations within our community. And as always, it will be a science-based approach. So another section of our plan will include our communication strategies. This will include a comprehensive plan that includes message development and dissemination via a lot of different vehicles. So earned media, paid ads on TV, radio, always English, Spanish, and other languages as appropriate. Social media, both free and paid social media, direct community outreach. And we're really looking at contracting with media and communication companies as well as some of our community-based organizations to help with the outreach to some of our underserved communities. And then finally, we will continue to update our COVID-19 website. Next slide. So another section of our plan will focus on coordination of recovery funding. The County Administrative Office has convened a work group that includes some Board of Commissioner members, some staff, and really are looking at some of our funding opportunities like the CARES Fund. And first to cover, of course, our county costs. It's important that county government remains strong and healthy, and then look at what our community-wide response costs are. County Emergency Management is serving as the coordinating office for the information on all of the state, federal, and other loan or government programs. Okay. So the rest of this presentation, I'm going to just quickly provide an overview of the key initiatives that will be covered in the plan. So I'm going to just go through each of these, hopefully pretty quickly. And of course, ask questions at any time. So next slide. So beginning with our Washington County government. So this is Washington County government as an employer. It is this part of the plan. There's a separate county employer plan, and it is led by county administration, and really they're focused on keeping staff safe, so providing guidance, whether it's about telecommuting, workplace safety, all of the leave that we've had, all of our changes in policies. So it's about keeping staff safe, ensuring that there's community engagement, so things like having the availability of these kind of Zoom calls for Board of Commissioner meetings and some of our community-based meetings and commissions and advisory councils. And then also assuring that we're meeting the community's essential needs so that our business practices as much as possible are moving forward. And then there will be some focus in this plan on key public services, so local law enforcement and the Law Enforcement Coordinating Council, support for libraries and elections. Okay. So public health, and we've talked quite a bit about this, but the focus will be on case investigation. We will continue, as we do now, to interview each case that's defined by a positive COVID test, as well as presumptive positives. And so that is somebody that has been exposed to a confirmed positive case and is showing symptoms of COVID. So we will interview those as well. Contact tracing, we've talked quite a bit about. Isolation and quarantine, so we'll need to have spaces and all the supports that go around, including ensuring that people can meet their basic daily living needs if they are put into isolation or quarantine. So I think this graphic, we've had a lot of questions about what is the number of contact tracers that we need. And based on our current case investigations and what we're seeing nationally, just to give you an idea, when we interview one case, it can result in 12 symptomatic people. So that, remember, symptomatic means that we classify them as presumptive, so we treat them just like a case, which means now we have to interview all 12 of them as if they're a case. And then it will also generate an average of 17 people that need monitoring. So, and then you can imagine, and I didn't bring you lots of slides, but you can imagine those 12 presumptive, that each of them will also generate another 8, 10, 12 presumptive cases. So you can see how this can escalate into such a big job for contact tracing. Okay. So moving on, we will have a section on business and economic recovery. And you can see that the components for that are the Economic Recovery and Assistance Program, so working really closely with the county administrative group that's been working on that. Also, just providing coordination and support. There's a lot of questions, lots of technical assistance that needs to happen, and just a lot of communication with all of our businesses. Disease control technical assistance specifically that we'll need to provide, and then enforcement of any rules or regulations that come out as a result of the governor's reopening plan. The sectors that we have current guidance for, and this is not necessarily final guidance, but we're using it to help draft this plan. You can see childcare, restaurants and bars, retail, outdoor recreation, personal services, transit, and I also called out for small businesses because there's some general guidance for all employers that will be helpful, I think, to some of our small businesses in particular. Okay. So community services, so this is really the part of the branch of the EOC that has been really focused on what do our underserved populations need, and we have some specific high priority populations that we've been working with and we will continue to work with. So those are homeless populations. You've heard a lot about agricultural populations and migrant farm workers and our communities of color who we know have been disproportionately impacted. So that's ensuring that we have enhanced bicultural, bilingual communication in everything that we do, from our communication work to outreach to our disease investigation, contact tracing, and then continuing to work with and support our local community-based organizations. We are reaching out to them. We have been all along. We've had those calls every other week, and we are reaching out to them specifically now to help prepare them for some of these reopening guidances, and also to ask them to consider working with us through contracts to support the contact tracing, outreach, and communication plans. And then specific outreach to small businesses, women-owned, and minority-owned businesses.
Do we have a definition of a small business? I know at the federal level for the first CARES, it was 500 employees. Do we have a number that we use to?
I believe there is, but I don't know it off the top of my head.
25.
Was it 25?
25, thank you.
That was my recollection, thanks.
Yes. Okay, so the other component that will be required to work on in this reopening plan is our medical system of care. And that is really about a lot of communication, support, and mitigation to impact. So it's continuing to distribute personal protective equipment, continuing to make sure that folks are getting the guidance through our health alert network and contacts with hospitals, long-term care, a lot of guidance to our emergency medical services, and then other medical, dental, and behavioral health practices. Okay, and then the last section is long-term recovery section, and so that's really about what do we need to have in place for long-term recovery and resilience, and that is going to require a lot of regional coordination, making sure that we're on top of recovering those county costs, and that we're connecting businesses and individuals with different assistance programs, because it's not going to end in phase 1 or phase 2. So that's an overview of the plan. Next slide. So our hope is that we'll get you this plan to review by May 8th, and that we will have a conversation on May 12th and possibly consider any changes or adoption. So today, just with this high-level direction or high-level overview of the plan, just wanted to get some feel for whether you, and I don't need it right this minute, but over time to think about, are we headed in the right direction with this plan? Are there was there something glaring right off the top of your head that you think was missing, and you're like, well, why didn't you review this in the plan? And I guess just some verification that we do intend to stay aligned regionally.
So these are great questions, and we look forward to going over them in the work session when we have the opportunity of this framework information and board discussion.
Great, thank you.
One quick question. I thought on several slides back, you were talking about a PPE inventory.
Yes.
Did I see that correctly? It kind of zoomed by me there. Do you have an idea of what a PPE inventory for the county would look like if we're looking out into the future on some of this?
So the Health Preparedness Organization, which is a regional organization through OHA, distributes PPE to hospitals and health systems, and the EOC distributes the PPE to everybody else, so EMS, fire, law enforcement, behavioral health organizations, and there is a prioritization that's been created based on OHA, Oregon Health Authority guidance. And so we do get information now on daily burn rates. So in other words, how many they're using as we give them out every day. We're working in particular on some of these other health and medical, so the dental clinics and the behavioral health clinics, because those clinics have been closed. And as they reopen, we're working to determine what is the need for those types of clinics.
Yeah, I think where I was going was meeting the needs of today and then looking out into possibly fall. Maybe the demand mitigates a little bit during the summer and things like that. Then if we would have a kind of a resurgence in the fall or in the winter, we would have some inventory stored up, and we have been talking about what does that look like, what kinds of PPE, and certainly numbers, storage capabilities, all those kinds of things. So maybe if we could have that conversation.
Yeah, so there, the guidance from the prerequisite is recommending that the health systems have regionally a 30-day supply. I don't know exactly what that number is. I know that the health systems and the EOCs regionally are working on, well, what is that number for our region? Is that?
Yeah, that's good enough for right now, certainly. Thank you.